Hi, Dr. Likwani. My name is Lady. I'm a student pharmacy, and I'm going to be presenting this case today. So Ms. Angelina, 37-year-old African-American female, she presents with a chief complaint of fever, cough, and fatigue over the last 5 days. She also has some other symptoms of shortness of air and myalgias with sputum production. Her symptoms have been gradually worsening and impairing her daily functions. She hasn't been able to work in the last 5 days. She also states that her asthma and seasonal allergies are well controlled. Past medical history includes asthma and seasonal allergies, like I mentioned, and also hypertension. The family history is not really pertinent to this case. Social history, she's a non-smoker, and she doesn't use any illicit drugs. She's also not pregnant or breastfeeding at the moment. She does live with 2 children, and she does have federal insurance, Blue Cross and Blue Shield. Her allergy, she has an allergy to latex, which she gets a rash from, and she also reports allergy to penicillin, and the reaction is diarrhea. Her medications include calcium carbonate, 100 milligrams, 1 tablet twice daily, atenolol, 50 milligrams, 1 tablet daily, prenatal multivitamins, 1 tablet daily, ProAir Rescue Inhaler, 2 puffs every 6 hours is needed, Brio Ellipta, 1 inhalation every day, and then fluticasone, 1 sprayed in each nostril daily. Her childhood immunizations are up to date. She received her influenza vaccine on October 8th of 2019 and her Pneumovax on January 6th of 2008. Her physical findings are she's positive for chills, fatigue, fever, malaise, congestion, cough, sputum production, and shortness of air. She does not have any ear discharge or wheezing. She doesn't have abdominal pain, nausea, vomiting, or diarrhea. She does have myalgias, positive. Her breath sounds are normal, no wheezings or rails, and she does have tenderness to palpitation. Her vitals are, her blood pressure is 128 over 72 milligrams of mercury. Is that right? Her heart rate is 83 beats per minute. Her temperature is 101 Fahrenheit, which is a little bit elevated. Her respiratory rate is 16 respirations per minute. She's 70 inches and 150 pounds. And her BMI is 21.5 meters squares, which is within the normal range. Her chest x-ray was positive for right lower lobe pneumonia, and her left lung was clear. Her creatinine is 0.9 milligrams per deciliter. Her BUN is 8 milligrams per deciliter. Her creatinine clearance is 92 mLs per minute. White blood cell count is 13,000 cells per ml. Platelets are 300,000. She's negative for adenovirus and negative for influenza rapid test, and her curve 65 score is 1. So as determined by the chest x-ray, she does have community-acquired pneumonia, which is also consistent with the rest of her symptoms. She hasn't been hospitalized lately or in a ventilator, so that disregards ventilator and hospital-acquired pneumonia. Her curve 65 score is 1, so it indicates that this patient can be treated outpatient, and her labs and vitals are not concerning enough to have her admitted into the hospital. In addition to pneumonia, the patient has hypertension and asthma, which leads me to choose the double therapy of beta-lactams and macrolides. However, the patient reports having an allergy to penicillin, which diarrhea is not considered a true allergy, but I still want to keep it in mind for my treatment. According to the Community Acquired Pneumonia IDSA 2019 guidelines, my first option would be Augmentin. But again, the patient reports diarrhea, so this medication is not covered in her insurance, and also it's known to cause diarrhea, and I do not want to give something to her that she's not going to take because of the side effects. So I would choose ceftriaxone acetyl and azithromycin as an empiric treatment instead. And both of these medications are covered on her insurance. My goals would be to eradicate the CAP infection and to resolve her symptoms of fever, cough, shortness of breath, and myalgias. My treatment would be ceftriaxone acetyl 500 milligrams by mouth twice daily for 5 days, and azithromycin or a Z-Pak 500 milligrams on day 1, and then 250 milligrams day 2 to 5, and the duration of treatment will be 5 days as well. For the first, for ceftriaxone, I want to monitor the diarrhea and also seizures. And for azithromycin, I would like to monitor any QT prolongation and LFTs with CBC and differential. And signs of efficacy would be that the symptoms of the patient improves. This would be my recommendation for treatment. If you have any questions, please let me know.
Thank you.